And good afternoon, everyone. TJ Alls, I-45 Now. Welcome to another edition of Healthcare Unmasked, presented by UTMB Health here on I-45 Now. Topic today, we're talking about the taboo, an open discussion about screenings, colonoscopies, and colon cancer, as we talk about the issues dealing with your colon and colorectal health. And we're pleased to have on with us today to discuss that with us. Is Dr. Pamela Daher. She is a recent addition, we should point out, at UTMB Health. She got her MD from the Icahn School of Medicine in Mount Sinai in New York, and also had her surgical residency at Dell Medical Center at the University of Texas at Austin. And then, as I said before that, and then after that, Baylor Scott and White in Dallas, and then joined the faculty at UTMB. And Dr. Daher, thanks for coming on with us here today. We appreciate you having here. We're going to ask, someone's muting up here a little bit here. My apologies to you folks. If we're going to, let me see if that makes it a little bit better here. Dr. Daher, I think we're getting a little bit of a feedback on your mic here. That'll make it, when you're talking, I'll go ahead and turn you back on each time here. But Dr. Daher, thanks for coming on with us. We appreciate your time here today. First, let me just ask you as we get into, and also you see on the screen, sorry about that, Kevin Ferguson. He himself is a colon cancer survivor. He's going to share his personal story here with us in just a little while of what he had gone through in dealing with things at UTMB Health. But first up, Dr. Daher, let me ask you, I mean, folks they'll hear the terminology but not really understand just what is the colon, so people can understand better.
Yes, well, thank you for having me. Glad to be here. So when we talk about the colon and colorectal surgery, it can be very confusing for patients. This is Colon Cancer Awareness Month, so I think it's appropriate to start with what is the colon and the rectum. So the colon, as you can see in this illustration, is your large intestine. So those words and those terms are interchangeable. Colon, large intestine. And it's connected to the rest of your gastrointestinal tract, to your small intestine. And basically it receives all the food that's been digested and it absorbs water. That's what it does. It absorbs water, prevents you from getting dehydrated, and creates more formed stool that eventually passes through your rectum, which you can see on the picture on the right, highlighted in green. It's basically the last portion of your large intestine that's surrounded by muscle. And the rectum holds stool and it pushes the stool out of your body at the appropriate time.
And when we're dealing with issues because there's a whole case of situations where folks would deal with on any given time with colon. What are some of the warning signs that you may have an issue going on with your colon?
So, issues, if you're everyone has a baseline, right? Number of times they go to the bathroom, their stool looks a certain way. Everyone gets to know their body over time. So changes to your baseline habits, changes in the way your stool looks, changes in the way you go to the bathroom, or the number of times you go to the bathroom. If you have blood in your stool and you haven't had blood before, of course this is abnormal. If you're having more bloating, more discomfort before, during, or after you eat, any change from your baseline digestion is abnormal and should be discussed with a healthcare provider.
And one of the things we're talking about, as you said, is Colorectal Cancer Awareness Month. And can you explain to folks what that is?
So March is Colon Cancer Awareness Month, and as colorectal surgeons, people in medicine, we like to raise awareness. And why? Because colorectal cancer is not only the third most commonly diagnosed cancer in America and in the world, but it's the second leading cause of cancer death. So it's a cancer that affects many. It's very common. And it's actually very preventable. So when we talk about cancer, when we have a cancer that's so preventable and so treatable, we need to raise awareness so that people are more educated on it so we can continue preventing and treating this cancer as best we can. You can see here in this diagram over 140,000 Americans are diagnosed with cancer, with this specific cancer every year. So this is no small number, and we need to take it seriously. Over 50,000 Americans will die from colorectal cancer each year, and this number could be lower. So raising awareness is very important.
We should note with that, is it 50,000? Is that about 50,000 people every year
Correct.
die from colon cancer? But it doesn't have to be that high of a number. There's actually, it's very treatable, preventable also in many cases. Can you talk about that? It is because when you and I had an interview the other day about this, that was one of the kind of the more interesting aspects to me was how preventable this is and how you can get to this early, and we could avoid seeing the death toll being as high as it is.
So you can see on this diagram as well, that middle picture, that's a polyp. A lot of people ask me, Doc, what's a polyp? And when I say it's a little tumor, they get scared, but it really is just an outgrowth. This is a picture of the inside of a colon. And the white is a snare instrument that's removing this little bleep, this little polyp in the middle of that colon. That's how most cancers start in the colon. They start as a small benign growth, a polyp that we can easily remove. So you can see how if we follow through with our screening colonoscopies and our screening methods, when we find these polyps early, we can remove them even before they become a cancer. So that's what we talk about, awareness and prevention. And if you move on to our next visual,
let me get it here.
When we're talking about prevention, finding colorectal cancer early or even before it's been diagnosed as a cancer, finding it when it's a polyp means that 9 out of 10 people can be cured and survive after being diagnosed with colorectal cancer past their 5-year mark from diagnosis. That's a 90% survival rate for early detection of these cancers. Now you can see immediately next to it in green, 1 out of 10 individuals will survive to their 5-year mark after diagnosis with colorectal cancer for advanced disease, meaning disease that hasn't been found early, disease that has spread to the liver or the lungs or any other organ. So you can see that's a huge difference in survival from catching something early to catching something late. So that's why we're so concerned.
In fact, as we talk about survival rates on that, we bring in now Kevin Ferguson, who is one of those fortunate survivors, in fact. And Kevin, thanks for coming on with us. We appreciate your time here today. And I should point out, you're from Bay Cliff. You live in Bay Cliff, but work at Tyson Foods. You and I had an interesting conversation about that a little while ago. Why don't you tell us your personal story, Kevin, about dealing with colon cancer and how you were able to battle it and survive?
Yeah, sure. It started off, I did a stool test for the doctor recommended it, and it came up with positive for blood. And at that time, we were just moving to Bay Cliff, so I delayed going to the doctor, and eventually we got a new PCP, and she recommended I go and get a colonoscopy. And so I did, and when I went there, they discovered that I had colon cancer and 13 polyps in my colon. That was a scary time. My wife lost her first husband to cancer, and she was obviously really concerned. So we scheduled the colonoscopy, and Dr. Rashidi at UTMB did the surgery down in Galveston. The surgery was about a month after the diagnosis. I had a couple of colonoscopies on things, were going okay. And they took out about 10 inches of the transverse part of the colon. And I was in the hospital Friday afternoon. I went into surgery, and Sunday afternoon I was back at home. They did it through laparoscopic surgery, keyhole surgery. I was ready to go back to work that week, really. And they told me not to because of the internal stitches and things. So I basically was off work about 3 weeks. And my company, I work for Tyson Foods, My company were very, very supportive. They got in touch with me right away after the diagnosis to make sure that my mental health state didn't deteriorate or anything like that. And they were awesome. They gave me as much time off as I needed with short-term disability, which I really wasn't fully qualified for, but they did it anyway. And they were awesome. Then followed up every 3 months. I had to go and get a visit with the oncologist down in Galveston. I was very, very fortunate. I didn't need radiation or chemotherapy. They said that the cancer was almost through the colon wall, and that would have been a whole different story. So when I say to people, get a colonoscopy, it will save your life if there's anything wrong. I mean it. It saved my life without a doubt.
Let me ask you, Kevin, before that, had you gone in for regular screenings, a colonoscopy on a regular basis, or is this just was a one-off thing and it fortunate timing wise?
No, I did the stool test where you defecate onto a stick and send it off, and they'd always been clear. But once it came back with blood markers, that was my first colonoscopy.
Yeah.
Colonoscopies are not fun, but they're not painful either.
Right. Well, and it's a good thing to bring up. With let me ask you, Dr. Dar. We have seen a lot here lately. For example, you see these commercials of these kind of self tests. We heard Kevin talk about it. He would send them in. We're not saying there was a false positive of that, but what do you say on those tests? Those kind of self tests of are they effective for folks, or is there just no replacement for going in for a regular colonoscopy?
We like to say the best test is the test that's done on time. So any of those tests will contribute to an appropriate diagnosis. So like Kevin was talking about, the fecal occult blood test is one that's done every year. There are many different tests that include imaging, contrast NMIs that are given, or CT, CAT scans that are done. All of these tests are useful. Now, the important thing is that if any of those less invasive tests are positive or find anything abnormal, they are all followed up with a colonoscopy. So the colonoscopy is the gold standard, and it's the end result of any abnormality of any of those tests. So as you can see, it can be a build-up approach, or you can go straight to a colonoscopy when indicated. But it will all find an abnormality if it's there.
And probably a good time then to bring up this next slide for me is a colon cancer screening guide. Walk us through this about if someone's 45 and older, is that pretty much still this kind of the standard of when folks need to take a serious look at that, or are we starting to see it kind of trend even younger now?
Yeah, so that's a good point. It used to be 50 or older, and a lot of people still think it's 50 or older. Well, now the guidelines have dropped by 5 years. Now we're saying start at 45. And the reason for that is we're seeing colon cancer in younger and younger people. And the sad thing is that young people are often diagnosed later in the course of their disease because it's just not in anyone's radar that young people get cancer. So we've dropped the screening guidelines to 45. And now, mind you, this is 45 if you or your family doesn't have a significant history of colon cancer or certain other types of cancer. This is for an average risk individual. Individuals with other diseases like Crohn's colitis or ulcerative colitis or a family history of colon cancer, they need to start younger very often. So that's a very important conversation with your healthcare provider. But in general, if you don't have a history or your family doesn't have a history of a cancer like colon, uterine, or breast, you're 45, you need to start this conversation with your provider. Have you ever been screened? What are your screening options? And do you have any signs or symptoms that should speed up, the screening process? So these are the three major issues that should be discussed, and that will guide which screening is done and at what time intervals.
And Kevin had said it. They're not fun, but they're also not painful when you finally go in for a colonoscopy. And when we talk about that for folks is that. I mentioned this to you, having the history that's in my family. I'm a little more paranoid about this, and I will go in often just because I want that peace of mind. What is a good standard recommendation for folks that may not have the history of how often they should be doing some type of screening of some sort?
So no family history, no symptoms, start at 45. And if that colonoscopy is normal, you can do a colonoscopy every 10 years. If you're doing a fecal occult test, you start at 45 and you do it every year. And the other tests are usually anywhere between 3 to 5 year intervals. Granted, these are all if they're normal.
Yeah, Kevin, let me ask you here. Given your experience, if someone were to come up to you and say, "Well, I really don't like to, colonoscopies, obviously, but also it becomes a kind of a taboo subject, talking about the colon, the intestine. That's as my grandmother used to go, that's bathroom talk." Can you talk? What advice do you give to everyday folks about how engaged they should be about this subject?
Well, at work, I'm a great supporter of colonoscopies. I keep telling people, go get it done. I didn't have any symptoms. That was the scary part. I had no symptoms at all, and I could have just let it go, and I didn't. And I said to people, just get it done. Once every 10 years is not a big deal. I've been doing them once every year for the last 3 years because of my operation. They're not fun. I mean, I'd be lying if I told you the prep work was good. It's not. It's awful. It's only for 3 days, and you get something that is invaluable, peace of mind. If they catch it, they catch it. It's caught and it's out and it's done. I mean, I've been blessed. I'll tell you.
Yeah, you have been, and we're glad you're still around with us, obviously, too. Doc, here's from one of our viewers, Jim Weissenballer, says, "I was diagnosed with colon cancer at 43. Don't wait until you're 50. It would have been too late for me if I did. Colonoscopy is an easy procedure." He said he went to one where it's the whole one drink thing. Is that available? I want that as the option from now on. That whole drinking the gallon. Kevin, I think you went through that version, didn't you?
Yep.
It is the process that worries people. So is that an option now? Should someone bring that up if they go in for the colonoscopy? So give me the one drink type option.
Yeah. So first of all, I agree completely with this comment. 43. This is why we dropped the screening age to 45. And again, screening is for asymptomatic individuals. I do colonoscopies on patients that come to me at 30, 28, 33. They come to me with bleeding per rectum, and I do a colonoscopy on them. So symptoms equal colonoscopy for us, and that should be in everyone's mind. 45 is purely for someone that doesn't have symptoms. And yes, there are so many methods that are much better than the gallon of Go Lightly that everyone is terrified of because it's just disgusting, right? But there are new methods, 2 little 6-ounce bottles that you take a couple hours apart, and then you just drink water all day. Of course, you're still in the bathroom all day, right? But you're not torturing yourself with the drinking and the prep and things like that. So the uncomfortable part is having to go to the bathroom all day, but at least the drinking gets better, and there are many options that don't include the gallon.
Yeah, and I don't care what they say. It doesn't taste like lemonade, no matter how many of those little packets they give you, right, Kevin? I mean, it is something. It is something else.
Take it with apple juice.
Take with apple juice. Oh, hey, great recommendation. I've got another one coming here, not too distant future. I'll do so. As I said, my father had colon cancer and had to been a survivor himself and go through it, and that's why I take extra precautions and worried about that. Doc, let me bring this slide up now for us so that we can take a look at it. And this is hang on, I just hit the wrong button. My apologies. Here, we'll start it over again. And this is the deal with ways to prevent colorectal cancers. And if you can kind of go over this with us here, because there's a lot of steps folks can take, and it has great results.
Yeah, so again, this is a cancer that not only can be caught early, but it can be prevented. And we have more and more evidence coming out that our choices significantly affect our risk for colorectal cancer. Our intestine is at, it's exposed to everything that we eat. What we choose to eat goes through our intestine, it toxifies our intestine, it toxifies our gut. So making healthy choices, increasing the fiber in your diet. What's fiber? Fruits, vegetables, leafy things, fiber. Bran cereal, that's fiber. So increasing that, decreasing processed foods, decreasing red meat. Red meat, there's a direct link between red meat and processed meat and colon cancer. And it's hard to process that. It's hard to change your diet. I myself eliminated red meat completely 5 years ago from my diet. So there are small things that you can do to decrease your risk. Don't drink alcohol, but if you must, don't drink it every day. Smoking. Smoking is an all or none. If you're a smoker, you're not only going to have a higher risk of colon cancer, you're going to have a higher risk of not healing well from any type of procedure or intervention that we do for your cancer. And then exercise, staying active. You don't have to be a triathlete, but staying active, getting some movement in every day decreases your chance of colorectal cancer.
And if you follow most or all of these, you can cut your risks. Am I reading this right? Almost in half?
Yes.
That's amazing stuff there. For anyone to go along the way. Kevin, on that though, what had you done in your regular life? You work for Tyson Foods. We know it's healthy stuff coming out of there. But how many of those that we saw on that list there were you already following, and just in your general life?
Well, I don't drink. I don't smoke. I get exercise at work. But other than that, I do eat red meat. Still do eat red meat. I eat fruits and vegetables. So I was really pretty knocked back by it because it wasn't a genetic form of cancer, and I don't know where it came from.
Right.
That's what's bad about it. You don't know. You just live in your life, and suddenly, boom.
Yeah, and that one of the things too is that thing gets into you had mentioned it earlier. People don't fully understand a lot of times what's true, what isn't true. This is one of those cancers in which everybody has their ideas. Why don't we talk about the myths versus the reality of those, and if you can go over those with us too, because there is a lot of misinformation that's out there.
Absolutely, there is, and like Kevin said, you do everything right, and then sometimes you still get colorectal cancer, right? And genetics does play a role in about 10% of these cancers, but most of the time they're just spontaneous cancers. They happened, and it's in some people that are very healthy, like Kevin, and we still don't know why that happens. But that's going along with the first one. There's nothing I can do about getting colorectal cancer. Most of the time there is. Your lifestyle choices will decrease your risk, absolutely. Colorectal cancer is fatal. Sure, a lot of cancers are fatal if they're found late, more so than not. So like we had mentioned before, 90% of colorectal cancers can be cured completely. And like Kevin said, without chemotherapy or radiation, if they're found early. So that's a very easy disease to cure if it's found early. And again, what we had touched earlier, screening is only necessary for someone with symptoms or older people. False. We need to screen starting at 45 if you don't have symptoms, starting earlier if you have higher risk, meaning family history or personal history of other diseases. A big one I hear, and a big one that keeps people away, is colorectal cancer screening is not covered under most health plans. False. It is covered in most health plans. In fact, Medicare since '98 included colorectal cancer screening as a covered test, and many commercial plans cover all costs related to colorectal screening, including your bowel prep that you take the day before. And finally, Kevin touched on this, colonoscopy is a difficult, painful procedure. The only difficult part is having diarrhea for 24 hours. No one likes that, fair enough, but the procedure itself is not painful. You have some wonderful sleep, you're sedated during the procedure, you wake up, you go eat a wonderful breakfast after the procedure. So the only uncomfortable part is having to clean out your colon. The rest is pretty easy.
And again, that couple of days of dealing with that may be difficult, but it sure beats the alternative. And I'm sure, Kevin, if it was one of those things, if doing a regular screening and done stuff that prevented it, in that case, you would trade in, like you said, it saved your life. I was reading your quote there that the colonoscopy saved your life, and I don't think that can be emphasized enough. Do you?
Oh, absolutely not. No, I firmly believe that was a life-saving procedure I had with the colonoscopy. I would also add that sometimes if you find blood when you go to the bathroom, don't assume it's hemorrhoids. Go get checked out. Go get it checked.
And you bring up something we had the conversation about, Dr. Daher, about this too, is that there are times that it will be misdiagnosed. Someone will have blood, and doctors will even say, "Oh, it's hemorrhoids," and then they don't go beyond that. And you have said, don't just leave it at that.
Yes, correct. And again, especially in younger people, I've seen young people and old people come to me being treated for bleeding hemorrhoids for 6 months to a year. And by the time they get to me, they have disseminated cancer. So, people know their bodies. And a lot of those people said, yeah, I knew it wasn't hemorrhoids. I knew there was something else. I was having these pains. I was having weight loss. I was having diarrhea. And it just didn't add up with the hemorrhoid picture. When in doubt, just ask and push and try to see a specialist, because it can save your life.
For those of you just joining in, Dr. Pamela Daher is with us from UTMB Health, and then Kevin Ferguson, a colon cancer survivor who was treated at UTMB. And we're talking about, and again, it's one of those things that we talked about earlier that some folks just don't want to talk about the subject. About the only time you really actually hear about colon issues is when somebody's had to get ready for a colonoscopy, and all you hear is the negatives. Oh, I had to on the toilet for 24 hours, or I had to drink that horrible water, the flush, or oh yeah, I had to go through the procedure and the like. And as we have found here, that some of those myths that are out there, plus the reality to it, is not as bad as it be. And as our viewer Jim Wassenballer just pointed out, he says, "Don't wait," and that's why I wanted to talk about that screening we talked about earlier, starting at 45. I wonder, Doc, if it's one of those things too that is we're seeing with a lot of things that really patients overall for anything now have to start really kind of looking at their screenings earlier, that we're seeing those trend downward as far as age. You had said this, I think, in our pre-screening, that it's usually looked at as an old person's disease in colon cancer and colon issues. Can you address that? That's just not true.
It's still more common in the older population, right? 90% of these cancers are diagnosed in people 50 years of age or older. So there is some truth to that, absolutely. Cancer in general is a disease of the older. It's a disease of mutations in the body that accumulate with age. But there is a significant increase in the diagnosis of colon cancer and rectal cancer in the younger population. The increase is so significant that it's changed our guideline recommendations and it's changed the way we treat younger people. I mean, 10 years ago, we weren't, doing colonoscopies on young patients with rectal bleeding. We were just treating hemorrhoids or other, pathology. Now those patients are screened, and then we take it very seriously. And we see this with a lot of different cancers. We're seeing it with breast cancer. We're seeing it with ovarian cancer. Younger and younger diagnoses, and we have to take this seriously. And we don't know if this is an environmental thing or what's going on, but we're studying it and we're adjusting appropriately with our recommendations.
And again, I asked this earlier, but I did have a private text from someone asking about, where you see these self-screening tests out there. And it was a legitimate question I asked you before. I want to ask you again. Do you recommend that those be the tests, or a combination of regular screenings and the like as well? Just give those recommendations, because we see the heavy advertising right now, and some people may think, well, that's the only route I have to go. But what is the actual recommendation there?
The actual recommendation is, if you have symptoms, go to a gastroenterologist or a colorectal surgeon and get a colonoscopy. If you're having symptoms, if you already have blood in your stool, there's no point in doing a fecal occult test, right? It's just going to tell you, yes, you have blood in your stool, but it's not going to tell you why. So if you have symptoms, colonoscopy is the only diagnostic tool that I would recommend at this point. There are alternatives. It's a little bit complicated. If for some reason we cannot complete the colonoscopy, there are other things we can do. But the colonoscopy is it for symptoms. Now, the fecal occult test, and yes, all the other commercially available tests, I do recommend that for asymptomatic people if they're going to, adhere to the recommended intervals. So you cannot do, for example, a fecal occult test every 10 years. That is absolutely inadequate, right? That test has to be done every year. So it is okay to do those other tests under the guidance of a healthcare provider, so that you're sticking to the appropriate intervals that make them efficient.
And also, too, let me ask you along this lines, is that if folks wanted to get screened or to find out more information, how do they do so through UTMB Health?
There's a website at UTMB where you can easily go to and get some information on colorectal health. Yes. So the website has a lot of information, risk factors, signs and symptoms, so you can cross-check if you're having any signs and symptoms. The website has all our information, the colorectal surgeons. We do colonoscopies. We do screening colonoscopies. So if you call the number for our access center, you can easily schedule an appointment with us. If you have a gastroenterologist that you see, they also do screening colonoscopies or other tests, screening tests, so you can discuss that with them. And finally, if you have a primary care provider, that is your point person to start this conversation. They can provide some of the screening tests, and they can refer you to us or the gastroenterologist for a screening colonoscopy.
And again, if you go to utmbhealth.com and just type in colon, actually, that's how this site popped up for me. Or you can even go colorectal health, and you can find about that on the UTMB Health website, and they'll give you more information as well along the way. Dr. Daher, thank you so much for coming on with us here today. And Kevin, I'm going to give you a chance. Any final words to folks out there who may be in your position down the line? What do you recommend to them here, and any final thoughts from you about what you went through?
Yeah, I recommend that the people just start the screening. I mean, the screening I did, the fecal blood one, was done by the doctor. The doctor gave me it, and I'd been doing them for a couple of years and have been clear. Just because they're clear, don't stop. Just keep going. Keep going. Detection is the key to success.
And we should point out that your surgeon, she's no longer, Dr. Rashidi is no longer there, but you're quite happy with the treatment you got there, aren't you?
Oh, UTMB were marvelous. I had nothing but praise for UTMB all the way along. The nurses in the wards, the anesthesiologists, they were all marvelous. Kept me informed, kept my wife informed. We were just looked after greatly. It was I won't say a pleasant experience, but as experiences go, it was not bad.
Yeah, and the number is there on your screen, 800-917-8906, to go ahead, and that is the UTMB Access Center. And also, we want to one of our viewers here, again, and kind of reinforcing it, at 37, stage 4 colon cancer, and passed away just last November at the age of 41. And she's making that same encouragement: don't wait to get screened. We don't want you to panic about anything, but that's always a good piece of advice we know for everyone there. And final thoughts from you, Dr. Daher, on this subject.
Just pay attention to your body. Screening guidelines, age, everything is a recommendation. If you know something is off, if you feel something is off, don't sit at home. Don't wait it off. Just get checked. That's what we're here for. We're available 24/7. And if it's nothing, like Kevin said, you have your peace of mind. If it is something and we find it early because you got checked early, you will be cured and you will get your peace of mind back. So listen to your body.
Yeah, and we saw those stats earlier. You catch it early, it's a 90% survival rate. 9 out of 10 survive. Talk to Dr. Pamela Daher of UTMB Health. Thank you so much, Kevin. Thank you. Pleasure meeting you, Kevin, and sharing your personal experiences. We do appreciate you coming on with us here today. And we always thank the folks at UTMB Health for making this show, making this access available. And again, if you need to find out more information, you can call 800-917-8906. That's the Access Center to sign up to get in if you need to get in for a screening. And if you ever have any questions, you can go to utmbhealth.com, colorectal, and go directly on that link and you can find out more. Join us next month. We'll have another edition of Healthcare Unmasked. We approach the summertime. Here we've got a lot of special shows we're lining up to you. And if you have a suggestion, send it in to us here. We'd like to hear from you of what you would like to hear and like to know more about as far as keeping yourself healthy from all things health. And we thank our friends at UTMB Health for providing the information here today and our expertise. I'm TJ Alts, I-45 Now.